Hey, deserving listeners, couples therapy, Boris and Jessica. Let's continue their story.
He's used a couple of times the term about himself, monstrous.
Yeah.
Which is, of course, not at all how I see him. I mean, I feel...
Okay, this is cool. So we're getting a glimpse into the therapist's, well, they call it clinical advisor. I think they used a similar term. We don't use the word advice, and I think maybe they're using, now maybe in the East Coast or something, but I don't think they use these terms. We have clinical supervisors and clinical consults or consultants, but we don't have, now maybe the showrunners are being told that Dr. Virginia Goldner is a consultant or even a supervisor, and the showrunners are like, well, but the audience won't understand what that means. It's more like an advisor, which, you know, is fine, but that's not the lingo that we use.
So much compassion for how overwhelmed he is and his like painful search and restlessness.
Okay, so I'm really encouraged by what she is saying here, that she has a lot of compassion for Boris, because I was wondering, it didn't seem like she didn't, but it would be very common for people to dislike him and write him off, particularly because in the first couple sessions, at least for me, it was hard to like him. It wasn't hard for me to find compassion, to make some conclusions or some hypotheses about what would cause him to have the behavior that he had. But I'm encouraged by this, that she has that compassion, because that is what will drive good outcomes and a good relationship, and invite clients, like especially people like Boris, to begin to feel safe enough to heal, to admit things and take responsibility.
When we start talking about things that we do not agree on, it very quickly becomes, how could you possibly think this way, Jessica? It doesn't make sense.
It just sometimes reaches such a fever pitch that I fly off the handle.
It's not just you asking things. You bring a very judgmental air.
Yeah, so I'm going to take a guess and say that he learned that from somewhere, and that the way that it's being described is even putting it nicely. I wouldn't be surprised if it was quite toxic, the way that he will, because even in the little bits that we've seen in the edit, the things that he has said, particularly in the first couple sessions, these very blanket statements like, she doesn't know how to predict the future, so I have to make all the decisions. I mean, he basically said that. So you can imagine in a conflictual conversation, when he's really triggered, that it would come out much worse, right? So she is telling him this, like, that narrative and the way that you see things. And I would assume, given what we know so far, that when he feels threatened, and it's either threatened on attachment, that he feels like Jessica's going to leave him, or when he feels like I bet you anything. So there are some common themes in the schemas and the traumas that people come to therapy for. There's always specific flavors that every individual has that makes it unique, but there are certain fundamental relational traumas that show up. One being what I think Boris has even said himself, is that he's not good enough. That if only he were better or perfect or made better choices or something, if only those things were true, then he would be safe and he would be loved. We're very driven by safety and by security. Safety meaning that we're not going to get harmed, that we're out of danger, and that we're secure in our attachments, and that we have loyal, dedicated people who are looking out for us, that are there for us, that are, that are warm with us, that will hold us, that think about us, that will share with us when we need things, that sort of. So we're very driven by those two things. And those are the things that I'm often talking about that are the primary emotional concerns of ours, which is in conflict in particular, that we're whenever we're in conflict, whenever we're annoyed, whenever we're irritated, whenever we're fighting with our partner, at the baseline level, we are either worried we're going to get abandoned or we are hurt about some indicator from the other person that indicates they don't love us or they don't want to be with us. So so both the attachment and abandonment relate to both safety and to warmth and security, if that makes sense. I'm trying to avoid lecturing too much, but I'm running on the assumption, I can't know, but this is the hypothesis I would have. It's a fairly strong one because it always pans out this way. I could be just involved in confirmation bias, which is probably at least partially true. But anyway, so what we're hearing is that when they escalate in conflict, he starts saying, you don't know what you're doing. You're incompetent. I need to make all the decisions. How could you possibly come to that? How did you get there? That doesn't make any sense, right? And there's some logical flowchart that makes no sense from the outside, but does make sense from the inside, given his traumas, that something she did or something he perceived or some circumstance led him to believe that he was on the verge of being harmed and that he was in danger, or that he was on the verge of being abandoned and he was going to be alone and he's not good enough. And so it goes through his psyche and through all his traumas and his memories, and what wires together fires together, and what comes out of his conscious mind and his mouth is, you are wrong. You're always wrong. You're incompetent. You made the wrong choice.
To your questions when you ask me things.
He needs containment, and there's no containment, so it keeps going out geographically and verbally. And you could be such a person. You could help him bear up under it and live inside of himself rather than outside of himself.
But
All right, just chiming in here, quick little break. The rest of this video is going to be for just members of the YouTube channel. So if you're seeing this, you probably aren't a member. And if you become a member, then you'll be given a different video, actually. That's the full video. That's the way it works. And you can become a member by clicking the link below. Otherwise, please take care of yourself because you deserve it. You really, really do.